But the other challenge, as we've worked past these last few months, has been to prepare Australia for a vaccine.
Hey guys, Rukshan here. I just want to talk about the announcements that were made today by Scott Morrison, Greg Hunt, and another person who's involved in the rollout of the vaccine in Australia. So the announcement is on the coattails of what's happening in the UK because they've got emergency authorisation now to start rolling out one of the vaccines from, I think, next week. So it's quite soon. So the announcement that was made here was really just to kind of give people some clarity around what's going to happen in Australia, because a lot of what we do is tied to what happens in the UK and what happens in the United States to an extent. So the major takeaways, I'll play some of the clips from the announcement today, and I'll just kind of comment on my thoughts on what's being said. But the major takeaway was both Scott Morrison and Greg Hunt said that the vaccine won't be mandatory at the moment. They didn't completely rule it out, I would just to be fair, because there was a question asked about no jab, no play, and Greg Hunt pretty much said at this point there's no plans to tie it to any such programs. So it wasn't completely ruled out, but they made it very clear for the present time that it's not mandatory in Australia. What is mandatory though is that there is mandatory reporting of whether you've taken the vaccine or not. So the government does want to keep a database of people in the community who have taken the vaccine. Now, for what purpose? It's not 100% clear, but it just looks like for record-keeping purposes at the moment. So here's the comments that they've made. I'll just play some of the clips.
But as is the case with the vaccine and the many other challenges that we face, we've got to get that balance right, and we will implement the vaccine here in Australia according to Australian needs and Australian conditions. And as we move into the vaccine period, our first priority is that it be safe. It must be safe for Australians, and that's what they would expect of us. So the vaccination policy has been established, it has been agreed by Cabinet, and it has also been endorsed by the National Cabinet. In Australia, we're in a very strong position, and that enables us to get this right, to get the balance right, to ensure first and foremost the safety, which enables us to then roll out the vaccine successfully across the country.
So even though in the UK they're going to start rolling it out next week, it doesn't look like in Australia until maybe January, April, March, we won't have any progress on this. Now, the reason is that we're in a position where we can watch what's happening in the UK because we've managed to contain the COVID outbreak in Australia and managed to get ahead of the pandemic, but it's a different situation in the UK. So they've had to get this emergency authorization and administer it to the population a lot sooner. So in many ways, even though it's they didn't really want to call the what's happening in the UK the population guinea pigs or whatever it is, we are in a better off position to be able to see what happens with this vaccine. So it's not a done deal. I think we're going to be observing what's going on, which is the sentiment that I got from the statements that were made by Scott Morrison and Greg Hunt. But they were very, very pleased with the announcement in the UK because it just does give them a chance to watch how that program rolls out there.
Then there is the regulatory approvals process. That's currently underway. John will give you an update on that, but that's at an advanced stage. We're moving quickly, but safely. And we're making sure there are no compromises because the safety of Australians is the number one priority. But frankly, the work that's being done in the UK will give Australia and the world very important data, very important lessons, both on the rollout and the efficacy of this particular vaccine, but vaccines more generally. And it's an extremely positive and important development for the world. We are on track for decisions on the early vaccines by the end of January. We are on track for first vaccinations, beginning with our health workers and our aged care residents, subject to approvals in March.
We have not got complete data on any of them because globally these companies are still assessing their final data, and that's why in the UK the decision is what's termed an emergency authorisation. It's not a full regulatory approval.
Now, in terms of the mandatory record keeping of whether someone's taken the vaccine or not, there was a question asked whether a company like Qantas or any other private business would be able to access that information directly from the government. And it was made quite clear that at the present moment, there's no system in place for them accessing that information directly from the government. It would have to be you would have to give that information voluntarily to Qantas. But just because they touched on those topics, I think it's important to note that there is this kind of acknowledgement that it will be a period of time where businesses will ask for that type of information. No jab, no fly, whatever it is. So even though the government's not making it mandatory, I think there is kind of a silent admission there that companies will have or will be asking for that sort of information. And that was even made clearer to me when I heard Scott Morrison comment on being a part of this global initiative to make sure that the vaccine that's taken in Australia and the vaccine that's taken in countries overseas are quite similar in terms of their effectiveness. Now, why would you be doing that unless you knew there was going to be a situation where you would be either tracking people before they come into your country or before they leave your country to one of those other countries to ensure that they're on the vaccine. So even though the government's not directly involved in making this mandatory, I think there is a bit of a grey area there where they know that, for certain things to go back to normal, particularly around travel and flights in the country, there is an element of you're going to have to be on the vaccine before you can do that.
It's going to be voluntary, and that at this stage there are no plans to impose or to draw upon other programs such as the No Jab, No Pay.
But there is, I think, a great need for working together globally to ensure that there is a common set of recognitions around vaccines. That's going to be very important because obviously in countries around the world there's going to be different vaccines in Indonesia, in Malaysia, in the United States, potentially across Europe, China and so on. And so it's important that there is a common understanding globally about vaccines, their efficacy and what will satisfy standards, because that would otherwise mean John and all of his equivalents all around the world will have an even more difficult task than they need to have. Now, we've indicated that we are very happy to engage in such a global effort, and I think we have a lot to contribute in that area because we are quite well advanced in this area, being one of the world's leading immunisation nations and with one of the strongest regulatory systems of anywhere in the world.
The fact that there is a database means that if the need ever arose, they could easily make something like this mandatory and see who's taken it and who hasn't taken it. And if they were to implement something like No Jab, No Pay in the future, or No Jab, No Play, whatever it is in the future, if they're going to implement something like this, they would already have the records there of who's taken it and who hasn't taken it. So it'd be a very easy thing to implement in the future if need be for any reason. So apparently this has always been the case. We've always had some sort of our immunisation information on a card, and now it's just digitized. That's the main difference.
So the immunisation register already exists. Think of it as a digital yellow book. Many of you would have had the World Health Organisation yellow books growing up, and like me, you've probably lost it over the years. And so this is an online version. It actually exists already. And the change here is simply that whilst we maintain as an absolute article of faith voluntary but strongly encouraged vaccination, we have mandatory reporting of vaccinations for flu, for the National Immunisation Program, for diseases such as mumps, rubella, pertussis, and for COVID-19 vaccines. And that's very important whole of nation public health information, but it's also critically important information for individuals. No, it's private. It's your medical record, and it's nobody else's.
You said before that access to the national access to our immunisation records is an individual level. Is there any work underway to be able for us to provide that information to, say, Qantas or other airlines that need that data, like an app or something like that?
No, there's not any prospect of it going directly from the government. It's a matter of individual control of individual records, and I reaffirmed that in the Parliament this morning.
There were also some comments made by both Scott Morrison and Greg Hunt to a question around anti-vaxxers and how seriously we should take the disinformation and misinformation. And Greg Hunt kind of brushed it off and said, they're not really having an effect on the landscape in Australia. And Scott Morrison took it a little bit further and said that if need be, they will, use the correct authorities to fight against that misinformation or disinformation. I'm not sure exactly in what way he means, but I'm guessing it's stopping that information from being shared. So some sort of censorship. Now, it was interesting because a few questions later, they asked him about a movie that's been made about Martin Bright and the massacre that's happened in Tasmania in the 90s. And when it came to that, he was talking about how, we have freedom in Australia, and there's a freedom to make that kind of content in those shows, and that's kind of one of the good things about living in Australia. So it's interesting to see that when it comes to health and health information, governments are more open to censorship because it's just about controlling that message. Whereas when it comes to other things, they're a bit more open to the ideas of freedom, and that's been the case throughout this pandemic. Definitely, that's what I've witnessed. Because even at one point, Greg Hunt thanked the media for its cooperation. So, as long as you're kind of towing the government line, I think they're happy with whatever you say. But yeah, if you go anywhere beyond that, they're happy to look at ways of controlling that information.
So, the anti-vaxxers perhaps are getting more coverage, but they're having less effect. And so I've got to say that we're aware of them, but frankly, they're not winning their case, but we'll continue to prosecute ours.
People need to know. I mean, every Australian takes their health very seriously, and particularly when it comes to making decisions about the health of their family, and we'll be doing everything we can to make sure they have as much information as possible. And as you say, if misinformation or disinformation is being presented, we'll be also seeking to proactively address that through official channels, which you'd expect, and I think that's very important. Now, I think it's a free country, thankfully. We all celebrate that.
And I remember going down to see Tommy at the Wacom Bay in Mount Martha. Still serves the best prawn crackers on the peninsula. And
well, it sounds like we've got prawn crackers for the cabinet drinks for Christmas, Greg. You better get on to Tommy. If Professor Skerritt gives it the tick, then I'm happy to take the jab.
So look, overall, this was always coming. I think we're always going to be watching what was happening in the UK, and our response was going to be predicated based on what happens in the UK or the US. So this is just kind of natural progression. I don't think Australia was ever going to take the lead on this, purely based on the number of cases we have and the urgency that we have here. Even though the government really pushes the idea of having a vaccine for things to return to normal, I think they were always going to watch what happens overseas. So this is the first real step in that, and you kind of sense that we're entering a new phase. So it'll be interesting to watch over the next few weeks how this progresses, especially what's happening in the UK. It should be watched very closely in terms of how effective this vaccine is, or how safe or how dangerous or whatever it is, and that steps and our government takes to kind of share that information with us, because they were saying that they have access to this information. So if there are any issues, I think that information should be shared with the public here as well, because this is very different to any other time. This vaccine is being researched and developed in a very, very quick manner, warp speed manner. So I think that information definitely needs to be shared with the public. Well, thanks for watching, guys. Let me know your thoughts. Will you take the jab? Would you take the jab? What do you think about what Scott Morrison said? What do you think about what's happening to the people in the UK? I really do feel like they are the first of the guinea pigs for this new vaccine. So yeah, share your thoughts, and thanks for watching again.